What is up, Guru Nation? How's it going? It's Dance Fair. I'm here in a lovely, sunny Los Angeles with Dr. Al Jazeera. You might recognize him from the Clinical Research Circle. We do stock talks. So today is a very special. We're going to get all of Dr. Al's secrets for how he stays informed, not just as a researcher or an investor. I mean, he doesn't even recommend this for investing, but just to get your brains, right? People in research, get your brains going.
To
Learn
go out of the box to look into things.
out of the box. Okay.
Okay.
So give us some journals that you recommend, like the ones you see here.
For oncology, for me, for review, I have two big journals, which is the Journal of American Clinical Oncology, which is produced by the ASCO, American Society of Clinical Oncology, where they have this, and also the Journal of Clinical Hematology produced by ASH, ASH,
Okay.
American Society of Hematology.
Okay.
And both of them, they have other update in between this product, which is like the ASCO Post, okay, which is another one. But out of the medicine and like this, for like reading, is like the Science magazine is produced by the AAAS, okay, American Association of Science, and this is like give you an idea about what's coming up in the world, about new idea, new discoveries, and new things that can come up, and let you know. You know, for me, I like reading it because it's like out of medicine and tells me a lot about other stuff. And
Look at the price tag on this bad boy. $15. It's 3 Starbucks, guys. Maybe 4 if you order.
no, it is like, it's not like this. I have like annual. For the last, like, I think 10 years, I have an annual membership, like, for not very expensive at all, and they send to me a copy every month of this. I read what I'm interested in, mainly in new technology, new
It's
discoveries.
impossible to read everything, right? Or do you read all of it every month?
Usually, I try to set up a time for me to read, okay, at least like 45 to hour and a half a day, while I'm sitting, like, because this is like, you know, it's a leisure reading. It's not something like really to consider. If something I need to know about more like this, I rip the page off and leave it aside and read it in more concentration, or try to summarize it and add it to my file or pile of the article that I have.
And you also said Nature is a good one, right? Another one is
Nature is another one that's also, but I that's enough for me. 4 or 5 magazines in a monthly
That's
one.
enough,
That's
right.
you know, I can't.
And we have to add a caveat. So you're an oncologist and a hematologist, so you have specific to your specialty.
Exactly.
But in any specialty, they have journals.
Exactly.
How do you
yes.
find these things? Like, let's say you're a CRA, like somebody like me who's a CRA.
Mainly, most of the specialty have a society, American Society for Clinical Oncology, and this is the society, American Society of Dermatology, that they produce the Journal for Dermatology, American Society of Thoracic Psychiatry. They have like special psychiatrists magazine and magazine.
Do you recommend CRAs or CRCs if they want to learn more about their domain to subscribe to these things and to read, to stay current?
It depends on what their field. If they want to be current and more current in their field, like if you have a CRA or CRC, like especially for oncology, and she wants to be more into her field, because this is give you update about the clinical trial and what's happening and everything in the clinical trial. Okay, all update
So it gives
about
you like
results.
cutting edge, what's new, what's the latest
Exactly,
going on.
up to date.
And you
okay?
said you learned about CRISPR from these magazines.
Actually, I learned from CRISPR, from this, and from science.
When was it? What,
In
how long?
2010, 11, when I first like start talking about it.
Wow. Because
Yeah.
people are barely starting to talk about it now in the mainstream. It's not even mainstream yet.
I think from
So
that
this was
time
10 years ago you get.
Yeah.
So you
That
you
was
knew
not
about
even
it.
in the stock market, but like
Yeah,
having
right.
the idea of something like playing with the gene and doing
Yeah.
the genetic coding and like this. It's amazing idea was for me. It's so fascinating that I went through it.
What do you tell the people that say, well, I'm not a doctor, Dr. Al, and, you know, what do you tell? What advice do you have for them? It's still good
It
for
depends
them?
on what's your interest. If you're into research and like really, you're not doctor, but into research, and you want to be like on top of your field, you need to, you know, you
Yeah.
need to learn stuff.
So
You know,
even
you cannot be on
CRA,
the top.
CRC.
Yeah, you can't be in the top if you don't follow the research and if you don't educate yourself. But this is in general, like for just like some thing
your-
that I read to just to feed my brain with new information.
I like
Could be
it.
junk information, could be something
I
else.
like
could
it.
be
So
ideas
science-
for me to look into research and EV and electronics and something.
Mm-hmm.
Okay, as always, this is because tell you the newest thing in innovation in general.
And it does help us with the investing here and there. It helps us understand the language better
Exactly.
than anything.
And that's
else.
what you need to know when you go into these kind of things.
All right, guys, just something different to get your brains going. Get your brains going. You hear from Dr. Al. Thank you very much, Dr. Al.
You're welcome, Dan. Anytime.
All right, guys, get to reading. Bye-bye.